Forgive me, Senator Risser, in the midst of your questioning, because I would think as a association coming to testify, yes, I do know that you speak for Wisconsin, but I would think if you know that there are multiple states that are doing this and you have peers in those other states, it's no different than when the legislation was being considered. I talked to individuals from other states to find out, well, what do you think in what's happening? I just find it a little shocking, and so I think what I would ask, no worries, but there's always tomorrow, and so what I'm hoping is that you would help me to get the laundry list of what associations that are your peers in the other states, what are they saying? And more than anything, in some states where there has been, the use has happened, I find it very difficult to believe that there aren't any individuals that are prescribing, and more importantly, individuals who can talk about this lack of knowledge or study that you speak of, because I just got a feeling that they've got a few patients and that they could at least speak to that. And then I think I want to back up, and although I hear you and I hear the concern, and I think that there's some legitimacy in what you say, I also sit back and I think, as an African American woman, when pharmaceuticals are studied, they often aren't studied on people who look like me. And so often the effects on people who look like me are very different than individuals who don't look like me. But often there have been recommendations to move forward with certain pharmaceutical choices for various illnesses, and the effect on African Americans, for example, completely different. Why? Because we often haven't been studied. So although I hear you saying that we don't have the data on treatment, and so what to recommend, I've watched the medical industry recommend things all the time that have not been adequately studied on people of color, and the effects on African Americans in particular have been significantly different, but they move forward. So, I just want to say, let's not make it seem as if it's just that, especially if in 20 states, I got a feeling we would know. Like if, family uses CBD and everybody drops dead from the use of it. I just find it very difficult to believe that there's no knowledge or nothing, that could be acquired. And so I'm just extremely challenged by that, especially when I read information about states that have began to use even medical marijuana. When I look at the amount of addiction that has existed in our state and around heroin in particular, a number of people who are dying because of it, to hear in my own city and candidly individuals that are close to my own family almost killing themselves, and to know that 25% reduction in prescription painkiller deaths, which is something that is a spike in our state, in states where there's been medical marijuana use. And now we're not even talking about medical marijuana, we're talking about CBD oil for individuals who want to be able to reduce seizures. There's studies. I think there has to be a will to find the connection, for people, because even where there isn't study, we've made recommendations that people should use those prescriptions. So I'm just a little torn, because when I hear the stories and I think of the risk, of some medication, like, the amount of risk that, and they say them on the commercials. I wish I could think of one now. One of the commercials where they say all the different stuff, and then you're like, why would anybody even want to take that? But it's because
information to be able to make that decision.
Well, that's true, and for people to have the information. So I get, as I said earlier, about you wanting to make sure that information is available, right, for people to be able to make sound decisions. But I also know as a mother, and as a parent that, there's nothing like, the internet, and there's nothing like gathering information from also all of these individuals in these other states, which is why I was shocked. I would have hoped that you would have come and said, here's information from the association in Minnesota, in Iowa, just in that fashion, to be able to say, they're in states that this is happening, and, they agree with me or they disagree with me. I have much more respect for the organizations that come and give me the positive and the negative, you know what I'm saying, and not just telling me don't do it. When I'm looking at people who are telling me, you're asking me to choose between taking a portion of my kid's brain out, when maybe if I had access I wouldn't have to make that choice. I have problems determining if I should take my kid's adenoids out, and it's not the brain. And so, and whether or not I should do the surgery for him to be, when they clip everything for the penis, I can't remember what it's called. Circumcised, I'm sorry. Whether or not he should be circumcised. Oh my goodness, I had to call my mother over to care for him. And that is a ritual that some would say we shouldn't do, and associations recommend it.
Which is why you should be able to have your conversation with your physician and try to take what your physician says.
Well, I got it. I got it.
Physician has to have the information to be able to do that. And as far as the studies being done or not being done, we're hearing that from the FDA, we're hearing that from federal organizations, we're hearing that other places. So, and the other piece that I just have to, I'm sorry to go there, but I will go there. I don't treat my African American patients any different. They get a family history. We still use the same medications that I use.
Of course you do, but if you're going to sit there and tell me, with all due respect, and to suggest to me that you don't treat them differently, with all due respect, my skin doesn't react. My skin doesn't react the same way that someone else's may.
Some folks that are whiter that have.
Well, that's true. However, the issue was not whether or not you treat your African American patients differently. The issue is that there aren't studies that happen on the prescription.
But there are studies in human beings, which is
with all due
more
respect,
than what there is with the CBD piece.
And I disagree with you, because you have states where people are using it. So clearly the information is available, and I think the issue is, you said, the issue, to speak to what you said, was the data is not there to know. And I'm saying to you that studies have shown that the effect on medication on individuals of color, that there's a difference in the effect. If you sit there to suggest to me that that's not so, then, I guess you're right, then there is no need for us to have that dialogue, because you're not going to have the conversation in truth. Now, the reality is that there is a difference. I'm just saying that if we can prescribe, when we know there's a difference that happens on people of color, and there hasn't been the studies. Now, there have been some more efforts to study those things, but there haven't been studies, and we prescribed. I'm saying if we could do it then, here you have individuals who, they kind of created their own study, because I think she said it's kind of like the Wild Wild West in a way, because people are doing what they have to, because the alternative is, well, just cut out a section of your kid's brain or your loved one's brain. And so I'm just saying to you that that the reality is, it's where there's a will. There has to be a will to study medication and its effect on people of color, and there has to be a will to study these options. And what I'm asking you to do, to go to what Senator Risser said, is to tell us what your peers, because I do care what the Wisconsin Medical Society says, but you have peers in 20 other states. And I'd like to know what they say, because they're in those states that have changed the law, and I don't hear them ringing the alarm of, oh, lordy, lordy, what have we done? And I instead hear families telling me of a complete transformation in their child's life. And, and I know, as a lawyer, the one thing you never do is ask a person, a question that you don't know the answer to. But I can speak for myself. If I'm put in the position, what would you want to do for your kid if there's, you know, some additional options. And some people are willing to say, we'll be the trailblazers, so that that research that you speak about can exist. But if the medical society or individuals in the medical industry are saying, well, we kind of like sort of, you know, don't want to see us go there yet, let's just let the feds move this slowly. Well, the kid who's having 50, 100 seizures in a day, it's every seizure in a way is taking away the possibility for them to exist for that moment. So I just feel very compelled that we're not the first state, and there has to be more information than what's been brought before us from the medical society just to say no. And so please, the other 20 states, I want to know what your peers are saying. Thank you, Mr. Chair.